Hi, this is Dr. Dan Margolin going over the next in our series of most commonly asked foot questions on heel pain or plantar fasciitis. Well, this is one of the most common problems that we see. Usually patients present with pain with the first step in the morning. They get out of bed and it hurts. It usually feels a little bit better as they've been walking on it, and then again hurts at the end of the day. Now that's not always the case, but that's pretty typical. So let's go over why would that happen. Well, first of all, the plantar fascia. The word plantar means bottom and fascia means tendon, and essentially this is it. It runs from the heel to the toes, and its function is to do this. As you step down, the arch comes down, that tendon tightens, stops you, and allows you to push off. In some people, the arch comes down, but it keeps coming down, and it tears and it swells. And that's what plantar fasciitis, the itis means a swelling of. So usually when you present with this problem, what we do in the office is, one, we take an x-ray because we want to rule out other things, stress fractures, bone tumors, things like that. Two is we do an ultrasound many times to measure exactly how swollen is that tendon. Normally that tendon should be 4 millimeters or approximately 4 millimeters. If the arch is dropping, it's very easy to pick that up, and you can see it swollen at 6-7 millimeters. Gives us an idea how severe the problem is. Once we've determined that it is plantar fasciitis, the next treatment is called a Lodi test. What we do is we tape up the arch to take the pressure off that tendon, and we ask you to walk for about 24 hours. Then we see you back. If you're 90-95% better, many times we make what's called an orthotic or a customized support to take the pressure off that area. If you're, let's say, 50% better, well then usually we'll use cortisone as well to just get the inflammation out. If you come back and you're not better or you're worse, many times we'll immobilize it and get an MRI just to rule out things like a stress fracture that we might not be picking up on the x-ray. This is Dr. D. Margolin, just reviewing some more of the most commonly asked foot problems. Today's was on heel pain or plantar fasciitis. Thank you so much for joining us.